Good evening, everyone. Thank you, Sankoda, and thank you, the whole team. Thank you, sir, for coming here and gracing the occasion. So, I gave the title, Magical, Devices. Why magical devices? You see, we have amongst us, I have called 2-3 of my special patients, whom when I see, I really, get happily surprised. They are still walking on this earth. And one is Mr. Bhaduri. He was the ex-principal of Mayo College, Jaipur. And I will tell all of you about his story, how we had to cross the line. Then we have Mr. Datta. He is ex-IITian. He has worked in various capacities in various companies. And he had a bypass surgery, pacemaker, and upgradation of devices, and how yes, sir, 21 years ago. And we also invited 1 or 2 people, like Mrs. Das is here, Mr. Ranjan Das, who owns many hospitals in Calcutta and surroundings, and he had a device which can give me alerts even if he is in Kuch Bihar, and there was a very surprising, incident happened. He was going to Murshidabad, and he just had a giddiness and syncopal episode, and he called me from there. Dr. Kumar, I have a hypertrophic cardiomyopathy. I have fallen, so I don't know what happened. And then the alert came to me. We got the device checked through online, and device can transmit data. And then I assured him, nothing has happened to you, just was merely a vasovagal or something like that. So this is how devices, gives us new life, and they are magical. So, next slide, please. Yeah. So, sir, ekun katha bollen heart attack niye, heart failure niye. Ami ekun amra heart attack theke khubi bhoy pai. Heart attack hole the time is muscle, so you have 12 hours to reach hospital to have a normal heart after angioplasty or bypass surgery. Kintu heart failure diye bhoy pai na amra. Ekun amra dekhlam artificial heart, ekun dekhlam heart transplant, and then we have some devices which can just turn around everything. And these devices, with the help of these devices, we go to the patients closely, and instead of patient coming to us, we can reach to patient. Heart failure niye apnake boli 2 বছর আগে আমার wife she told me আমার মা পা ফুলে যাচ্ছে ঠিক আছে no problem তা আমি দেখলাম ফুলে যাচ্ছে তো then I just did an ECG and echo. Then she was very apprehensive. He is not telling anything, what is happening. আমি ঠিক আছে ওষুধ খেলে ঠিক হয়ে যাবে এটা হার্ট ফেলিওর হচ্ছে আর তুমি অত রিল্যাক্স আছো. So this is the situation. Heart failure has a spectrum of kind of severity, and with medicine she is doing well. Then I told her আর কিছু হলে অনেকগুলো যন্ত্রপাতি আছে লাগিয়ে দিতে হবে, she will be all right. So this is the situation of heart failure and how we can save patients. Next slide, please. Next. So you see artificial intelligence, these devices, some of them are implantable, some of them are wearable, some of them are patches, and you can get to know about every know-how of your body, heart, how it is working. Next slide. So we'll quickly go through many slides, and you see how things have changed. You see the upper left hand, there was a galvanometer, and you can appreciate how the first ECG was taken. A man whose 1 foot was in saline, hand was in saline, then the galvanometer was making the ECG, and now we have just a small patch or small watch, wrist, one wearable can give an ECG. So things are, changing, for better. Next slide. And look at this. I always tell the most fascinating journey and kind of invention in medical fraternity is probably a pacemaker. So আমরা শুনেছি হার্ট অ্যাটাক, আমরা একটাও শুনেছি হার্ট ব্লক, পেশেন্ট অজ্ঞান হয়ে পড়ে যাচ্ছে. When the patient has a heart block, he has only 2 options. One is to get a pacemaker, or second, to accept the death. Nothing else, nothing in between. So this pacemaker gives life to a patient, and see how it has evolved. That gentleman was carrying the device, the entire, just like a generator kind of thing, and this was pacing his heart. And then it came to wearable. Next. This is how it has evolved. Now it is implanted, Next, please. Please go on. And this is now the capsule. It's just a 2-gram capsule, 2 gram, you see. And this can be implanted inside the heart. And there is nothing, no scar mark, nothing else. We go through groin. We just put the device, come out. So from turbojets, like just a big generator kind of thing, patient has to walk around. He used to live for 12 hours, 6 days maximum. To now we can give one device 20-25 years of life. And the best part is with these devices, patient is always under our surveillance. We can get to know exactly what is happening to the patient. Next one. And we can get the alerts, so as the patient. So we have a mobile, you see. We can see the app. Netflix app is there. You go and choose your movie. You can see your documentary, what you see. Similarly, we can have these devices these are connected with your app with Bluetooth. And you will get to know which device is being implanted, what's the status of the battery, what's happening to your heart. When you need to see a physician, there is an alert. So this is all now is in your palm, is in your mobile. These are all Bluetooth enabled devices which can give you real time information. So now let's come to the stories, patient stories, and it can link to the kind of devices, how miraculous that could be. So Mrs. Das is there. I will ask, if Sankhada can allow, I will ask all of 3 of my guests to just say their experience in 2-3 lines and 2-3 minutes. So this was the transmission I got from Mr. Das when he was in Murshidabad. There was nothing, no problem, and he was doing well. Next. So they are a little technical. I will just skip through all this. Next. Just keep on going. And yes, just hold on here. So this is, go to the previous slide, please. So you can see, I think many of you, or many of us, we know about this ECG and what is happening to this patient. There is a pacemaker which is here in the upper part of the left side of the chest, you can see here. So this is how a normal pacemaker is done, a pace device, and then 2 leads go into the heart. And through these leads, the heart is paced. And you see this ECG, आप लोगों ने हिंदी सिनेमा में देखा होगा या बांग्ला सिनेमा में देखा होगा, जो ECG आता है वो बड़ा, it is very, very sharper, you see, very PQRS, very sharp. And can you see this ECG? This is broader. And that is what is happening with the normal pacemakers which we give. This is not a normal QRS which we are giving. This is a chamber pacing and the QRS is wide. Next slide. So what happens? 80% of the patients, they do well, but 5 to 20% different literature, they develop heart failure. And then we synchronize these patients with the CRT device or conduction stem pacing. Next one. Click on this, just click. Next, yeah. So this is how heart contracts. You can see this is a simulation model. And if a chamber is paced, normal pacemaker is done, which is done in 99% of present patients. So suppose someone is getting a pacemaker right at this moment, somewhere in Apollo, in Manipal, he must be getting all these normal pacemakers, but they have this 20% chance of development of heart failure. And there, the new technology which gives us a brighter picture. Next one. Just pace. And this is how heart is simulated. So this is a story of Mr. Datta. He had a bypass surgery, and then he developed heart failure and heart block. I put a pacemaker, I think 10 years back. And then he developed heart dysfunction. His heart function became 25%. And then he was having shortness of breath. His kidney started, not working. Creatinine rose to 2.53. And then we had no option except going for synchronizing, and we synchronized with this device. And this turned around his life from 25%, now his ejection fraction is 55%, around 45-50%. And in last 2 years, I don't think he has been admitted again. He is doing well. So I will just request you to come after my talk to just say a few words. Next, please. Next, please. Just carry on. I will be finishing in 3-4 minutes. So this is the synchronizing the heart and the conduction system of the heart. So I told everyone that we pace the chamber the heart, the ventricle. But next one, next. Yeah, so you see, this is the cut section of heart. After the death, the autopsy, and you can see these bundles, you see, these are the electrical bundles. And you can all be perplexed, feel puzzled, how to approach and how to take your lead there to a conduction system pacing. So if we have to give a normal QRS, next one, like this, you see, this is not nastier, it is just like Hindi cinema or Bangla cinema or Hollywood. This ECG looks like a normal just PQRS, not broader. So this can be achieved only by a conduction system pacing. Next one. So we look at electrical parameters inside the heart. We chase that some of the parameters which we want. Next one. And then just click on this. And we, when we are satisfied, we feel that we have got the bundle and we fix the lead there. So just carry on, just move forward, please, move forward. Yeah. So this is story of Mr. Bhaduri who is sitting there. Mr. Bhaduri had again a bypass surgery done maybe 25-30 years back. It was in Noida. And he has so many students, all Myoites, and they are all dangerous guys. They will call you 10 times in a day. What happened to my teacher? He was such a popular principal there, and he happened to had heart dysfunction, kidney failure, and one fine morning, we thought that nothing could be done to him. He was already admitted twice or thrice in our hospital, but there was only one thing, there was silver lining. His ECG had a broader QRS, left bundle branch block. And there is a guideline which says, if you feel that, if you assess that patient's survival is not, expected survival is not 1 year, it is lesser than 1 year, you can't put a device. Then came the dilemma. Guidelines don't say to go for a device, and here is a gentleman who has a white QRS, only silver lining, where if I can fuse the QRS to a narrow QRS, things can turn around. But guidelines they don't say. But there was a breather. It is for CRT. It is not for lot CRT. It is not for conduction system with a CRT. So that is not falling in that guideline. I did a video counseling to his family. I think madam is sitting here, his daughter. I told the chances is only 20% of his coming out. This is just crossing the line. I am going against the guidelines, but this is the bright light which I see at the end of the tunnel, and you can take the choice. And then started coming, the calls, so many calls. Someone had, and you see, Myoites are really doing well. Everywhere they are, at the top. So I got many calls, and then I took him and got him, out again. I can't do that, because if I fail, my reputation will be it will be haywire. So the day I took him to cath lab, his heart rate was 120. He was barely able to speak. So I had just asked him to, sir, I will not do the do procedure on him, and I just told him to and family members I can't do. Then there was a push from his students. No, you carry on. Next day, we are there. We have accepted what has happened to happen. What will happen? We have accepted. So I took him. Please carry on. Carry on. Next. Issue this ECG. This looks like a normal electrocardiogram. This is what I got with a fusion of lot CRT. And then happened the story. Everything turned around. His kidney became normal, his heart now pumping at 50-55%, and now he is coming and telling you, your daughter, when is she going to Mayo College? But this is my personal opinion, don't send her to Mayo College. So I had taken, he has given me, his advices also. So he will be coming, he will be sharing some of the, his words to all of you. So it's surprising and miraculous, that's all I can tell. And I don't want to linger it. So there are many such devices, some innovations have come, leadless pacemakers which will be there in the heart, you can deploy in 10-15 minutes, patient goes home without any scar. So I want to conclude here, just a kind of optimistic final word that when we used to see heart failure a decade back, we used to feel very, very bad. What else can give? Lasix, Lanoxin, nothing else. Now, if a patient of heart failure comes, okay, let's see the QRS, let's see this, let's see an angiogram, can we use this device, can we use that device? And 99% of the cases, they come, they do well in coming 6 months. Thank you so much for the patient hearing.